Since the beginning of the COVID-19 outbreak, we have seen not only the spreading of the virus, but also a rapid spreading of racism and xenophobia. We have witnessed at the highest levels, in fact, of the Republican Party fanning irresponsibly these flames. One colleague tweeted that everything you need to know about the Chinese coronavirus, unquote. My district is home to nearly 32% foreign-born residents, with more than a quarter immigrating from Asia. This painful rhetoric has consequences. Restaurants across Boston's Chinatown have seen up to an 80% drop in business. And I believe this has everything to do with the rapid spread of misinformation and paranoia. It is critical that we stand against these insightful messages and assuage fear in our communities. And we do that by dispelling untruths and misinformation. We can only do that by sharing the facts. And that is why I'm grateful to have you here today so that we can get to the truth about this virus. 30,000 residents across my district are uninsured and lack access to health insurance coverage. Many of these people are low-wage hourly workers, food service staff, nursing aides, hotel workers. A day off from work due to illness could mean losing a month's worth of groceries. The CDC's website advises people experiencing symptoms related to coronavirus to stay home and seek out medical care, but it doesn't really address the realities of living uninsured. Dr. Redfield, if I am a symptomatic hotel worker who is pre-diabetic, uninsured, and lacks the savings to cover the cost of testing and treatment, what specific guidance do you have for me?
Very important question. Obviously, we want you to be able to stay at home. And this, I think, I don't know exactly where it is, Tony, but I think there's clearly a great recognition of this issue by the White House Task Force. And I don't know where it is as far as it is, in getting its way to you. But I can tell you we've addressed this as a critical public health component. We need these individuals to be able to do their 14 days at home and not have to sneak out for an hourly job because they have to pay for their cost of living. So I can tell you that the White House Task Force is addressing this. Tony, you want to add anything?
Well, Dr. Redfield, if I might, will the cost of testing be covered?
The cost of testing will be covered.
And what about treatment?
Cost of treatment will be covered.
Okay. And so, and I appreciate that these conversations are happening. In terms of information that is public-facing and accessible to the general public, as of this hearing, neither the CDC's portal for the coronavirus or its FAQ, frequently asked questions page, has information about what the tests cost, who will cover it, and whether uninsured people can be tested. And so this has contributed to the confusion and the panic. So can you please make a commitment today to add this information to the website?
We will do our best to clarify. Related to costs, particularly for LabCorp and Quest, they haven't really defined it, but they have shown their leadership in rolling it out independent of that. But I will get as much information as I can on that website and keep it updated.
So I can take that as an affirmative, a yes. Okay. Dr. Fauci, I'm uniquely concerned about people with autoimmune disorders and those dealing with underlying health conditions like HIV or lupus. Briefly, is there any specific guidance for how these vulnerable groups can protect themselves?
They fall into that's a great question, Ms. Pressley. Thank you for asking it. They fall into the category of those that I have been saying multiple times at this hearing and other places are in that category that if they get infected, likely many of these people are on immunosuppressive drugs, particularly people with autoimmune disease, that they need to take extra special precaution. In other words, they are vulnerable and they need to help protect themselves, and society needs to help to protect them. In other words, keep people who are sick away from them, keep them even more stringently apart from crowds, don't travel unless it's necessary on long trips, and above all, stay away from cruise ships.
Okay, all right. So I want to turn to another issue. One group we haven't heard much about are the 2.3 million people who are in prison or jail. Mr. Redfield, about 10% of federally incarcerated people are over the age of 60. Many of these people have underlying health conditions, and based on your own criteria, are most at risk for severe complications due to infection from the coronavirus. These individuals often lack access to alcohol-based sanitizer, hand soap, warm water, and regular showers. Dr. Redfield, yes or no, has the CDC offered guidance to the Federal Bureau of Prisons about the coronavirus?
Let me get back to you with the specifics of what we've done. I know we have guidance to the correctional system in general, but rather than give you a half answer, let me get back to you, and I will do that today.
Okay, so not a yes or a no, unsure.
I just want to be
report
accurate.
back. Okay, all right. So, certainly prisons can be incubators for infectious disease, and that puts those in prison at risk, as well as those who are employed there. What recommendations and protocols has the CDC provided to federal, state, and local correction systems about preventing or responding to an outbreak?
And again, Congresswoman, I will get back to you today. I want to be accurate with my response.
Okay, so you'll get back later today?
I will.
All right, thank you, Doctor. And just because the administration has touted an express commitment to criminal justice reform as a priority, this president has granted less commutations than the prior administration. However, with overcrowding, the federal correction system is a breeding ground for deadly outbreak. Dr. Fauci, has the president or any member of the task force raised clemency power as a method of preventing a potentially devastating outbreak?
To my knowledge, no, but they may have done it not in my presence, but to my knowledge, they have not.
Okay. All right, thank you, and I yield.